Good afternoon, everyone, and welcome to the latest SAAPD Public Webinar entitled When Teeth Attack, Understanding Tooth Pain in Children. We are delighted to have with us today not only one expert, but actually two. Dr. Kate, a dentist in private practice with a special interest in pediatric dentistry, and she's also passionate about changing the fear narrative around children's oral health, which we desperately need, we believe. Joining her is Dr. Mark Atkins, a pediatrician in private practice in Vredenburg on the West Coast, whose key interests lie in pediatric infectious diseases, neonatology, and medical education. Together, they bring a valuable interdisciplinary perspective to help us better understand the causes, the management, and the broader health implications of tooth pain in children. Over to you, doctors.
Thank you so much, Dr. Parbu, for having us. And it's so important to have these interdisciplinary discussions. And we hope that parents take this and continue the conversation with their healthcare professionals. Okay, so Dr. Atkins and I will jump straight into it as I start off with the signs and symptoms of pain. Okay, so before we start, I want to reiterate that prevention is better than cure. So parents, please take your children to the dentist as early as that first tooth comes out to even the age of 1 so that we can give you the guidance we need. Okay, so tooth pain can be caused by damage that tends to occur over a long period of time. And there are signs that can ring the alarm to prevent or rather tell you that pain will be coming. So parents, you want to look at behavioral changes. Maybe the kid is becoming irritable, clingy. You see them chewing only on one side. They're refusing to eat. There's difficulty eating. They avoid toothbrushing. So those are some of the behavioral changes you can look out for. And then we also have visible signs. That is now you're seeing that there are cavities in the mouth, also gum boils, and then also there could be fractures and shifting of teeth due to trauma. So, doctor, on your side, in terms of pain management, what can a desperate parent do?
So, Dr. Kate, thanks. This is a common problem that we see often in our casualty units. We get late night presentations and then we're stuck because what do? We're not dentists, so we really have to manage that pain. So it's obviously going to depend on the severity of the pain. So if you've got a child that's having a little bit of pain, you'll start with something along the lines of a syrup, or if it's more severe, a suppository is usually a good idea to have. Suppositories are always handy because obviously if your mouth is painful, you are not going to want to put something in there and it's going to be a fight. So you've got to judge the situation as it is. So usually what I tell my moms to do is if you've got a really sore mouth or sore body part or even high fevers that sometimes will go along with these children with pain in their tooth, I would start with a suppository like Empaped, which is the common one. There's quite a few other names for what it is, but it's basically paracetamol, which is like Panado in a suppository. And that one is usually easily available over the counter from your pharmacy, and always handy to have at home. So we would start with that. Or if it's really severe pain, something like a Panamore suppository, which is for the medical people, more a diclofenac like Voltaren, which has got slightly more anti-inflammatory properties. And that is unfortunately only prescription based. So you will have to know a good doctor to give you a prescription and always keep some of that on hand. It's considered in our world of pediatrics and emergency medication to have available all the time. If you are not in that fortunate position to have a suppository available, or if you're living in a part of the country where it's really hot and they're going to melt without a fridge, then you can have your syrups. And again, we start with basics. Something like Panado or Calpol, which is your paracetamol base, can bring some relief. If it's really severe pain, you can go to Nurofen or Inflamax, which is your ibuprofen base. And one of the other, I think, more underrated anti-inflammatory pain medications is what we call Ponac or Ponston, Phenemin, which has got a multitude of other names. And we use that, its base is called mefenamic acid. And usually we can use those medications as well. Just a word of caution, though, is be careful of your dosing and your intervals. Be sure of what it is and rather err on the side of a little bit of underdosing than overdosing. So make friends with your doctor to find out what your child's dose should be, and be wary of medications that contain codeine. So combinations that are commonly available are things like Stilpain, Soltropane, and things like that, because the codeine can actually cause quite a lot of lethargy and suppress their being. Usually what we would do is alternate these medications. So it's nice that the combinations can be alternated with each other roughly every 4 to 6 hours. So that should basically get you through the night if it's in the middle of the night, so that you can come and see your friendly doctor or dentist. But Dr. Kate, can you tell us maybe a little bit more about the causes of tooth pain?
Okay, there are a variety of causes from your normal tooth eruption. So I'm glad that doctor mentioned that you have to have those medicines ready at home, because even your normal tooth eruption can cause pain. So you have that, and you also have trauma through the playground accidents, sports that can cause pain. And then also something that tends to be overlooked is food impaction. That is now food getting stuck in between the teeth and it stays there for a long period of time. So we tend to tell parents that from the age of 3, teeth tend to contact, and now you need to introduce flossing. So in some cases, you'll find that the child has a small cavity, but the actual cause of pain is food impaction, food getting stuck there. Okay, so that's something to look out for. And then your popular cavities, it's one of the big causes of tooth pain, especially when it is involving the nerve, the pulp. So basically how a cavity forms, when plaque sits on top of the tooth over a long period of time, plaque has a family of bacteria. The bacteria consumes the carbohydrates and starch and releases acids. So now those acids are busy breaking down the tooth structure, and then it can lead to a cavity and then eventually pain. So now you want to intercept that acid release by making sure that you brush your kitty twice a day, flossing, and then also in between water rinses, drinking water, and also watching out for the diet. Yeah. So, doctor, tell us, what are other treatment modalities that we can use to help our kitties?
So, like you've said, and I think we need to reiterate this, prevention is better than cure in anything in medicine as well. So, keep on brushing your teeth, flossing like you should. That's really good. But if you are caught with these problems, then we need to look at other options to manage these problems. So, what I find often works, and this is often with the eruptions of the teeth when they are teething. We use things that are often readily available to apply to the gums and the area. Things like T-gel, Ashton's and Parsons has got a teething powder. Prodol has got a very good topical anesthetic, which means it numbs the area. So those are all things that you can possibly, in desperation, try and relieve the pain that is experienced there. Yeah. And then, strange enough, the throat spray Andolex that we use for the children when they've got sore throats is actually also a very good way to sometimes numb difficult areas, and something that should be easily available in terms of pharmacies, and sometimes even many of the households have that available as well. So that works really well, and especially the older children, you can apply that directly. And then cold actually does quite a good job of numbing it. So if you have your older children and you give them some ice blocks or something to chew on, or if you've got a child that's young, still in the teething process, and they've got the teething rings and things that you can freeze, obviously the cold there will also help to numb, and that works really well as well. And then I think one of the questions that a lot of people always ask is, but doctor, can I get antibiotics for my tooth pain? And this is something that we really, really, really have to warn against, because like you've said, not everything has a infection underlying the cause of the tooth pain. So antibiotics only work for infections, and then it's good to use them. But if you don't have an infection, antibiotics are not going to do very much to your current tooth pain. And at the end of the day, all you're going to do is start causing bacteria that are in the mouth and the surrounding areas to become resistant to the antibiotic. So one day when we really need an antibiotic, we're going to be unable to use that antibiotic because the bacteria is actually now resistant to this. So antibiotics is something that we should avoid at all times and where possible. Just remembering as well, antibiotics are not without their risks. There are risks of allergies and they have many side effects as well. So where possible, we would like not to use them. So Dr. Kate, after looking at all of this, what would your professional opinion as a dentist be as to who to see when the teeth start attacking?
So, doctor, with anything mouth related, your first prize is the dentist. Whether it's the teeth, the gums, in this region, you want to see your dentist primarily. But understanding South Africa and our situations, there are lots of people that do not have easy access to the dentist, but rather have a clinic where there's a doctor there. So that's where now the interdisciplinary approach is very important, where doctors have to manage the pain and then refer to the dentist. So it's very important. Your first prize is the dentist, and then yeah, if you don't have access, please do go to your doctor to get help with the pain. And I just want to ask something, doctor. Just picking back off the medication, I tend to get parents that use grandpa and Disprin on our kiddies, even rubbing the grandpa and Disprin there. So what are your comments on that?
Okay, so that is an excellent question. And I'm very glad you did ask that because we try where possible to avoid any form of aspirin. So that would be a Disprin, a grandpa, or anything that says contains aspirin in children is under the age of 12, but generally until they are about 16, I would say is a good time because aspirin has got a nasty side effect in children, especially if there's an underlying viral infection that's involved. That can cause the children to become extremely sick to the point where we can actually have a loss of life as a result of that. Other things that aspirin can cause, it causes a lot of bleeding as well sometimes, which is unnecessary. And it's really not good to use aspirin. And I must say, this is one of the home remedies that the old Buratanis or the Gogos come up with.
Yeah.
And we must really be careful with some of those that we use because they can definitely be dangerous for use
Yes,
in
yeah.
children.
And the fact that doctor mentioned bleeding, then it's also a risk on our side when now kiddie came with painful tooth. Now we need to extract, and they've been on the grandpas or the Disprins, and now their blood is thin, and now we are stuck with a kiddie who is bleeding. So this is yeah. So to our viewers, as we close off, this is an appetizer of the conversations that you should be having with your healthcare professionals. We can't stress enough for you to go for your checkups, whether it's at the dentist or the GP for other related causes or whatever you're experiencing. Please do see your healthcare professionals, and we hope that this has helped you to ask more questions and continue the conversations. That's all from our side.
If I may, I just want to add to that to
Mm.
say in our line of
Yeah.
work, there's no such thing as a dumb question. Rather ask a question and be sure before you just carry on and follow your own head.
Yes. Thank you so much, Dr. Padbu.
Thank you so much to both of you. I think that information has been really valuable for our moms and dads out there who are stuck in the middle of the night with an emergency and a crying child, and they just at their wits' end and don't know what to do. If I could just ask maybe a bit of a controversial question from my side. What are your thoughts on these like home remedy treatments for toothache, such as clove oil, or I know sometimes they use glycerine on the gums as well. What are the thoughts?
So you want to look at the ingredient. For example, clove oil, you tend to find clove oil in some of the ingredients that we are using as dentists. So, but as Dr. mentioned, now you want to look at dosage. So when you are at home and you are mixing a whole couple of things, we can't regulate that. So it would be best to rather speak to your dentist, because you find that some things in the mixture, it does help for a bit. But now we don't know in the long run what it is doing. So rather speak to your healthcare professionals and then you can get the proper guidance.
And from a medical perspective as well, if you're not 100% sure of what everything is, you got to be very careful with what you use, because some of our herbs and roots and more traditional type of medications can actually be very toxic for young children and cause rather prominent damage to livers and kidneys and things like that. So rather avoid if you're unsure.
Absolutely. I think that brings us to the end. I just want to see if we have any questions. No, we just have a comment saying, thank you so much, doctors. This was informative, especially with the old tales and home remedies. So yeah, I think that brings us to the end of this webinar. I want to just extend our heartfelt gratitude from SAAPD's side. We really appreciate you sharing this information and also just taking time out of your schedules to be with us today. So thank you so much and have a great afternoon.
Thank you,
Thank you so
guys.
much for having us.
Okay.
Thank you.
Bye.